Good morning. I'm here to bring you your daily mental health enlightenment, and today we are discussing technology-based mental health treatment. I got a request from a viewer to do a video on this after they saw my video on how to get yourself connected to a mental health therapist. They said that they had an interest in therapy and that they were looking at technology-based therapy, and they wanted to know my thoughts on the effectiveness of this. So first off, technology-based therapy is receiving treatment through text, a messenger app, email, a phone app, through the telephone, all these indirect ways of receiving treatment from someone. So it's not human to human, face to face. So first off, for people who are out there who are having a hard time right now, who are in the midst of a crisis and don't feel like they have the strength to actually reach out and go get your traditional based therapy, first thing I want to do is provide you with 5 of the top technology-based websites where you can get yourself connected with treatment if this is what you want to do. So I don't have any experience with providing treatment on these apps or receiving any treatment from these apps, but I did do some research and I looked up the top 5, so I want to provide them to you. So the first one is BetterHelp.com. The second one is MyTherapist.com. The third one is Talkspace.com. The fourth one is Breakthrough.com. And then the last one is for doing couples kinds of therapy, and this is Regain, REGAIN.com. So if that's something that you're looking for right now because you are in such a dire space, please reach out and get the help and support that you need. So again, this is from my perspective. This is not coming from experience of having provided therapy through technology-based means or having received it myself as a client. But there are 4 main concerns that I have when I even think about technology-based treatment. The first one is that you lose that human-to-human contact. In therapy, that's such an important part of the process, being able to get in there for the client to have someone who listens to them for a full hour, 100% of the time. The focus is on them, making them feel valued, accepted, heard, supported, that human-to-human piece. And if we look at attachment-based research, it talks about the importance of human contact to the development, to people being able to grow and develop and reach their next best level. So that's the first concern that I have. The second concern is that without that human-to-human contact, there is a decreased ability to identify and then recreate some troubled interpersonal or social dynamics that the client may have. A lot of times that's why clients are coming in, because they're having problems with their family of origin, they're having problems in their romantic relationships, they're having problems getting along with their boss. So much of what people come in about is interpersonal, and not having a relationship where you can identify and help your client to recreate their interpersonal dynamics, to me seems like a con of the service. The third thing is there's a decreased ability to identify the microcosms of the macrocosm. And so when we say that, what we mean is when people come into therapy, all they're doing is showing us in a smaller form how they act and behave out in the world, that bigger world. And so me as a therapist, having that contact with someone, I can help give them insight into some of the problem areas that they may have because I interact with them. So I feel how they interact. I feel the things about themselves that may cause problems. I feel the things about them that are great that they don't realize are great, because all they're doing is coming into therapy, doing in here with me what they do out in the world to people that they're not aware of. So it seems like technology-based means of providing therapy won't give you an opportunity to observe that as the provider and then to provide that feedback to the client. And then the last thing is that the therapist, because a therapist on a technology-based site can be from anywhere, so they may not understand some of the regional and cultural issues that the client is dealing with in the area that they live in. So now, having said those 4 things, I want to be clear, though, that I do think technology-based means is a good add-on type of service to provide to someone. So seeing someone face-to-face, and then your client having the ability to text you in between sessions, to call you in between sessions, to send an email in between sessions, I think is an effective way of providing expansive services, because it's my thought that when my clients come into my office, the 45 minutes to an hour that I provide to them is just the start. It's just the foundation of the treatment that they're getting. Then I'm sending them out into the world for 1 to 2 weeks without me. They should have access to me to be able to help them make sense of how to apply the things that we've talked about in our therapy. So I'm living in Cleveland, and the big hospital here is the Cleveland Clinic, and one of the things that they have is my chart, where a patient can email their physician in order to get in contact with them if they have any questions, if they have any concerns, any issues that may not warrant them coming back in for an office visit, but getting feedback from the physician that they work with. So the way that I talk about using technology-based treatment as an add-on is similar to that, what they're doing in the medical field. All right, so let's talk about 3 of the benefits that I see about doing technology-based treatment. The first one is it's more affordable. For instance, my rate per hour is $250, where you can get some of the lowest technology-based treatments that I saw were $35 per session. Now, I think that says something about the quality of the treatment that you may be getting, and the kind of investment that you may be getting from the provider that you're with, but I'm not sure because I haven't provided or received any services from these apps. But it is more affordable. The second thing is that it's more convenient. It works around the schedule that you have. So if you're working, if you have small children, if you have other commitments that have to be met that makes going to traditional therapy hard for you, then online or technology-based treatment is something that can work around all of that. And then lastly, and connected with that, is the boundaries of technology-based treatment are a little broader, a little looser. So there is no time frame. You can receive your treatment 24 hours a day, 7 days per week. You can work with the therapist from anywhere around the world, whoever is tapped into that app or website or technology form of treatment that you're trying to use. There is no limits on when you can communicate with the provider that you're working with. And so again, having been trained in the traditional way, there are some concerns about that, because we want to teach our clients how to have bounds. We want to teach our clients how to be respectful of the provider that they're working with, which will then bleed over into helping them be respectful of other people's time and the bounds and rules that they have for their lives. So we want to teach them that, but also for people who aren't able to adhere to some of the traditional bounds, like for somebody who has a panic disorder or agoraphobia and has a fear of leaving their home, then for that it can be really effective. All right, so I hope that my perspective on technology-based treatment has been helpful for you. All right, so what's the message? To think about mental health in a different way, a way that is expansive and includes technology-based treatment. And I'll see you tomorrow.